Okay, class, let's talk about eicosanoids for just a few minutes. There are local hormones that are released by all body cells. Some of them are called leukotrienes, and these are going to influence white blood cells and inflammation. And then we have prostaglandins, and prostaglandins can impact smooth muscle contraction, like blood vessels or the uterus. It can affect mucus production of the stomach. Now, remember, the stomach has lots of hydrochloric acid. So the body uses prostaglandins to produce mucus, which is this protection of the stomach so the acids don't erode it. Prostaglandins are involved in blood flow, fever, platelet function. So when a person uses ibuprofen and other NSAIDs, which are non-steroidal anti-inflammatory drugs, they're using them to treat the pain, to treat fever, and to treat inflammation. And that's because ibuprofen and NSAIDs are influencing, affecting, or blocking the prostaglandins. They are prostaglandin inhibitors. They block the production of prostaglandins. So when we look here, in order to get prostaglandins, which are involved in inflammation, pain, and swelling, and we need inflammation, right, to heal, especially after injuries. These come from arachidonic acid. That's the precursor of prostaglandins. Arachidonic acid is in your cell membranes, and it comes from food. Shellfish has a lot of it, peanut butter has a lot of it. Animal produce has lots of arachidonic acid. So from arachidonic acid, we make prostaglandins, but we can block the conversion of arachidonic to prostaglandins using either these COX-1 or COX-2 inhibitors. The reason why they're called COX-1 and COX-2 is there's an enzyme called cyclogenase. Cyclogenase, they abbreviate as COX-1 or COX-2. Aspirin and ibuprofen block type 1, and type 2, this would be like Celebrex for rheumatoid, like for arthritis, that's a type 2. If you block these, you never get prostaglandins. But if you can't get prostaglandins, you're not going to feel the pain. Well, that's good, right? But if you take too much aspirin, let's go back to this page, that means you're blocking the mucus production in the stomach. And if you can't produce mucus in your stomach and you have hydrochloric acid in your stomach, you're going to have acid without the insulation or protection. You're going to get an ulcer. That's why people get ulcers with these pain medications. When you have prostaglandins that are being produced, you're going to get smooth muscle contraction. So a woman during her monthly bill, that time of month, you're going to get muscle contraction of the uterus. Prostaglandin, like ibuprofen or any type of NSAID, will make the cramps go away. It'll bring down a fever. Aspirin can block clotting, right? They're blood thinners because they inhibit platelet function. So prostaglandins are very important for normal physiology. If you bypass and block them, you can alter a lot of natural functions that are supposed to happen and really get sick. From arachidonic acid, we also get leukotrienes. These are involved primarily with airway issues, like with asthma, chronic constriction of the airways. So when the body has too much leukotrienes, you're going to get bronchoconstriction and airway obstructions. These are your causes of asthma. Okay.